Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today we're excited to turn over the podcast to the students from St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy in St. Louis. We give credit to Professors Stephanie Lucas and Terry Hollick for mentoring these students with their leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions as shared today are those of the hosts and our guests, are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis.
Hello and welcome to the Pharmacy Frontiers podcast. My name is David Grigorzik, and I am a P2 student pharmacist at the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy. I am joined by Luke Beeman, Barrett Lohman, and Eric Reagan.
Hi, my name is Luke Beeman. I'm a student pharmacist, P2 at the St. Louis College of Pharmacy at the University of Health Sciences and Pharmacy.
Hi, I'm Barrett Lohman, and I'm also a P2 student pharmacist at the St. Louis College of Pharmacy at UHSP.
Hi, my name is Eric Reagan. I am also a student pharmacist here at the St. Louis College of Pharmacy at UHSP.
Furthermore, we also conducted an interview with Dr. Bob Zabrowski, who is a professor of history here at UHSP and has also written a book on the history of pharmacy called A Brief History of Pharmacy, which is an easy read and one that I highly recommend if you find our podcast interesting. Today, we are going to be talking about the history of pharmacy and, more importantly, the direction that pharmacy is heading. First off, pharmacists are the medication experts. Pharmacists do not primarily count pills in the pharmacy, and they have a massive impact on your life. Pharmacists have played a huge role in healthcare throughout the history of humankind, starting around 500 AD, with the first pharmacies opening in Baghdad in the 8th century and the regulation of the profession beginning around the 17th century. In the 19th century, during the Industrial Revolution, there was a shift in pharmacy from personalized remedies for patients to pre-packaged medications for the general population, which is commonly seen today. Lastly, in the late 19th century, pharmacy began moving into a more clinical role in hospitals, becoming an active member of the healthcare team. For our podcast, we are going to go over more recent changes in the profession of pharmacy in the United States, starting in the 1960s, moving to the present day, and then going further into the future of the profession. To begin, imagine that you are going to your local pharmacy to pick up a medication for your 8-year-old daughter who has been sick for the past few days. Your daughter has been to the emergency room and several other clinics, and each physician has called in a new medication. As you are picking up her prescriptions, you are worried that these medications will interact with each other because none of the physicians talked with each other before they called in their prescriptions. How do you know if the medications are safe for your daughter to take? To get us started, we'll have Eric to talk a little bit about what pharmacists did during the 1960s and 1970s.
Thank you, David. If we rewind back to the past around the 1960s and 70s, the role of the pharmacist in the United States is drastically different than it is today. By the 1960s and 70s, community pharmacy compounding had just started to become less common amongst pharmacies. According to a statistic from Gregory J. Higbee, in the 1930s, 75% of medications were compounded. This number continued to fall to 25% by the 1950s and less than 5% by the 1960s, and finally only 1% in the 1970s. Although hospitals still required many compounded medications by the 1960s and 1970s, mass-produced, manufactured drugs had become the norm for community pharmacies. As a result, pharmacists began to stop compounding as many drugs, turning their focus to the retail side of community pharmacy and trying to get more involved in patient care.
Could you possibly quickly explain what compounding is to the audience?
Yes, of course. The FDA defines compounding as a combining, mixing, or altering of ingredients of a drug to create a medication tailored to the needs of an individual patient. Examples of compounding can be pharmacists making gels, lotions, creams, tablets, capsules, and much more. Actually, pharmacists have always been very experimental and creative by nature. In the early days of pharmacy, many of the drug formulations and medicines did not taste very well, especially to children. To fix this issue, pharmacists needed to use their clinical expertise and knowledge to compound new formulations of drugs that would taste better and still be effective. Many pharmacies introduced soda fountains during this time due partially to the fact that carbonated water was believed to be a healthy aid at the time. These soda fountains were so effective that people would drink these sodas even with the drugs in them, and they helped to improve the taste of the drugs. As pharmacy began to change in the 1900s, medicines were taken out of the drinks, and we were left with a sweet, sugary beverage. One fun fact about pharmacists is that they actually helped to create many of the sodas that we still drink today, such as Coca-Cola, Pepsi, and Dr. Pepper. In our interview with Dr. Zabrowski, here's what he had to say about the pharmacy's role in the creation of sodas.
Yeah, pharmacists had a huge role. I mean, almost every soda that you can imagine, with the exception of a few, there's only like one or two. Anything that you see on the shelf, a pharmacist probably had a hand in making. The first of them was Dr. Pepper. There really was an actual Dr. Pepper. He didn't invent Dr. Pepper. It was a pharmacist from Brooklyn, and his name escapes me right now. He was working in Waco, Texas, and when he had bounced around, and he had been in a pharmacy in Virginia, and there was an actual real Dr. Pepper. He went out with the doctor's daughter and whatever. So there's an actual real Dr. Pepper that, and so he mixed together whatever it is, 27 flavors or whatever, and again, that was an age where I think, sometimes there are things that are lost, the idea of the soda fountain in a pharmacy. And there are still a few. I know there's one in downtown Indianapolis and that I've been to. There used to be one here in Clayton, Jennifer's Pharmacy, sadly, but it closed down. They had a soda fountain and a sandwich bar, which was too bad. I used to go there when I was in Clayton, but it's gone. And, essentially, the early sodas were basically syrups, and because it was really before refrigeration. So they came in the form of syrups that would be compounded by the pharmacist. And then they would have a bicarbonate of soda that was under pressure in tanks, and you'd have to physically mix the syrup with the soda or whatnot. And then of course the best known of them is Coca-Cola. That's John Pemberton. Pemberton had been a Civil War veteran. He was wounded at the Battle of Columbus, I believe, in his arm, and he was given morphine. And he still suffered from pain afterwards, and he was desperately trying to find some way to get off morphine, which he never quite could. And he created there was a wine cola that was used in France called Vin Mariani, and he had learned about that, and he created his own version of that here. But then, of course, in Georgia, there was a temperance movement, and then, of course, there's no alcohol supposed to be in it, so he had to find another way, and that's how Coca-Cola was born. The original Coca-Cola, essentially the two ingredients, coca leaf, and it did. The original Coca-Cola had about 5% cocaine in it until it was outlawed in 1913, the Harrison Act, Narcotics Act, and he took the cola nut, and of course he worked in a pharmacy in Atlanta, Jacobs Pharmacy, and they sold it. Sadly, he contracted cancer, and he was in a really, really bad shape, and he needed money, and so his son sold the formula for Coca-Cola to a businessman named Asa Briggs for $500.
Wow!
So he could pay some of his dad's medical bills, and so that was and that's of course now Coca-Cola is one of the leading corporations in the world, and if you ranked it in terms of country, it's like it earns more money per year than most countries do.
Again, that was Dr. Zabrowski talking about the pharmacist's role in creating some of the most famous brands and sodas we see today. Pharmacists were always innovative and creative throughout history. However, moving forward in the 1960s and 70s, pharmacists were seen more as dispensers, and it was not believed that the pharmacist could play a big role in patient care and clinical decision-making. Although pharmacists were seen in this way, many pharmacists always cared about their patients, and many pharmacists wanted to be more involved in the patient care process. At this time, many pharmacists began becoming innovators and trying to transition pharmacy into some of the modern aspects we see today. Authors Benjamin Urich and Emily Meggs mention some of the earliest transformations of pharmacy, especially in the community setting. The first person they mentioned was Eugene White, a pharmacist who as early as 1960 completely transformed his pharmacy from a soda fountain and retail store to a pharmaceutical center that had a receptionist and kept a record system to keep track of families' prescriptions. Keeping track of records like this was very rare during this time and is a concept that we still see in pharmacy today. Urich and Meggs also mentioned some bigger organizational innovation during this time, such as in 1966, when the Indian Health Service required private patient counseling areas in all of its new pharmacies. These innovations were not common at this time and helped lead to the development of some of the pharmacy practices we still see today. These pharmacists were pioneers that helped to expand the clinical practice and patient care of pharmacists. They did not see their customers as a way to make money, but for the first time, they were also being treated as patients in the community pharmacy setting.
What were some key challenges that pharmacists faced during this time that resulted in them not being able to be involved in patient care?
One of the big issues in many pharmacies during this time was that there were no centralized patient profiles among pharmacies. Most pharmacies at the time were independently owned and there was rarely communication between pharmacies. Technology at this time was minimal compared to today, including almost no electronic health records or insurance databases. A patient could go from one pharmacy to another, and the pharmacist would have no idea what the patient was taking or if they had bought the drug already. Lastly, there was a limited communication between pharmacists and physicians. If something was wrong with the prescription, the patient would have to go back to their physician and get a new prescription. Thinking back to our scenario from before, in the 1960s and 70s, if your daughter had been prescribed multiple medications from multiple different physicians, the pharmacist at the time would not have had the proper technology, tools, or authority to step in. Because the pharmacist at the time were viewed more as a silent dispenser, you would still likely be worried about the potential dangers of taking the medications together and would have to decide without clinical judgment what to do. This is part of the reason why in the upcoming years, big changes were made to give pharmacists the proper tools and authority to catch these problems and increase the pharmacist's role in patient safety.
Following Eric, next up we have Luke here to talk a little bit about the role of pharmacy between the 1990s to the 2000s, where some pretty influential laws came into play and resulted in massive changes in the pharmacy world.
Alrighty, thank you, David. In the 1990s and 2000s, the profession of pharmacy undertook two massive changes that changed pharmacists from silent dispensers, as Eric described, to providing clinical services. Firstly, after the passage of the Omnibus Budget Reconciliation Act, also called OBRA 90, pharmacists were required to review the entire profile of Medicaid patients before dispensing medications.
Luke, what does a pharmacist's role look like when reviewing patient profiles?
Pharmacists check for drug interactions, scenarios when drugs cannot be used with certain patients, duplicate drugs, incorrect doses of drugs, or an incorrect duration of therapy, drug allergies, and the misuse of medicine. In addition, pharmacists were required by OBRA to offer to counsel on all medications that were dispensed to Medicaid patients. Consequently, most insurance plans adopted the same policy as Medicare, and now it is common practice for pharmacists to review the entire profile for patients for all prescriptions that are dispensed. This change shifted pharmacists from dispensers of medication to educators. The second big change that occurred in the early 2000s was the passage of the Medicare Modernization Act, or the MMA. The MMA famously created Medicare Part D benefit, which covers prescription drugs for patients on Medicare. However, in addition to Medicare Part D, the MMA stated that the insurance companies were required to cover medication therapy management services.
What is medication therapy management, and why do you think it's so important?
So, medication therapy management services are similar to the requirements of OBRA, which was the first law that I talked about. For example, pharmacists had to gather a complete list of the patient's medications, vitamins, and herbal supplements, identify drug-drug interactions and times that drugs were being used in duplicate, create a written plan to manage health conditions, communicate with prescribers to change therapy, and document that therapy. However, crucially, these services became billable, and the pharmacist could be paid for providing these services. As a result of OBRA and the MMA, pharmacists became critical members of the healthcare team and were now providing clinical services to the public, changing from their former role as just medication dispensers, or the silent dispenser that Eric was mentioning earlier. If you want to hear more about this topic, be sure to listen to the Pharmacy Frontiers podcast on What Do Community Pharmacists Do? Now, I understand that there was a lot of information that I just gave you, and it is not necessarily the most interesting. However, this is why it's important. Thanks to the new laws such as OBRA and the MMA, pharmacists can check and verify prescriptions to make sure that patients do not take medications that interact with each other. Even if your physician calls in a different prescriptions, your pharmacist will make sure that your medications do not have any significant drug interactions, even if the physicians don't talk to each other. Now let's take a look at our scenario again. When you pick up your medication for your 8-year-old daughter, you can be assured that it is safe to take these medications because your pharmacist will protect you from medications that slip through the cracks. The pharmacist has already reviewed your daughter's entire profile and determined that your medications will be safe. This was a monumental change that occurred during the 1990s and 2000s and is the foundation for where pharmacy is heading today.
Thank you, Luke. Now last, but surely not least, we have Barrett here to talk about the present-day pharmacy that you might be a little more used to, and then go on to the future of pharmacy and what we can potentially come to expect.
Thank you, David. Modern-day pharmacy is changing every day. We are starting to see more every day that pharmacists are being trusted as medication experts as they are receiving different prescribing powers. We are starting to see a push forward in the pharmacy profession that is focused on patient care. One big advancement in the recent years is that pharmacists are receiving prescribing powers of hormonal birth control that expands access to contraceptive care. By allowing trained pharmacists to directly prescribe and dispense self-administered hormonal contraceptives, patients can receive these medications without the need for a prior visit to a physician. This model improves convenience for patients, particularly in underserved areas, and has been shown to be safe, effective, and well received by patients. As of July 2025, 38 U.S. jurisdictions have enacted laws or regulations that authorize pharmacists prescribing of contraceptives.
Barrett, why do you think it's so important that pharmacists gain prescribing powers?
Yeah, that's a great question, David. It's very important that pharmacists gain more prescribing powers. One reason being that more prescribing powers gives us improved access to care. Many patients struggle to get timely appointments with physicians, especially in primary care shortage areas. Pharmacists are among the most accessible health professionals, so prescribed power means quicker care improvement in patients. It also leads to reduced healthcare costs because if a patient's being treated quicker, then there is less cost down the road because you are preventing complications and potential costly ER visits due to side effects. These, along with the fact that we are medication experts, are the reason why it is important that we gain more prescribing powers. Another example of advancement in the profession of pharmacy includes how pharmacists can perform point-of-care testing and treatment for conditions such as COVID, flu, strep, and more. This is transforming access to timely care and elevating the role of pharmacy professionals in a public health setting. This is largely due to the COVID-19 pandemic, in which pharmacists rose to the challenge and delivered critical testing and treatment services under the temporary Federal PrEP Act authorities. This emergency flexibility shows the profession's readiness and capacity to meet urgent needs by improving patient outcomes, by reducing burdens on overtaxed health systems, and helping millions of Americans get access to care when and where they need it. Now, you may be asking yourself how pharmacists have the time to spend helping patients by checking their profiles and dispensing medications rather than counting pills, which takes a lot of time. One new technology we are seeing in pharmacies is automatic counting machines. These have been integrated into pharmacies for years now, and it is being implemented through the use of machines to prepare patient prescriptions. This advance has increased productivity and efficiency of the pharmacist. As pharmacy continues to progress alongside technological advances, the integration of some of these technologies can begin to work their way into the world of pharmacy. According to a study titled The Future of Pharmacy Work, How Pharmacists Are Adapting to and Preparing for Future Technology Infusion by Natalie Martini, moving forward into the future of pharmacy would require a few things: increased government support, increased personalized education on the integration of new technology into pharmacy, and increased efficacy of computer software in pharmacies. The support from government officials would increase the power of pharmacists, allowing them to work to their full potential and at the top of their license. Furthermore, the change of computer software in pharmacies would require a large development while also requiring extra training and education for pharmacists. This integration can lead to increased efficacy of prescription filling, monitoring, and patient safety.
In what area of pharmacy do you expect AI integration to be the most influential?
Yeah, that's a great question. I think that AI will be integrated into pharmacy by reviewing patient profiles. This can be extremely useful to the pharmacist to run through a patient's profile and quickly flag potential drug interactions, safety issues with the medication, and potential duplicate therapies. While some of the software in pharmacies can already do this, I believe that AI will be able to critically think about these decisions and inform the pharmacist on its findings. However, the limitation to AI is that it cannot imitate human interaction that is so essential in the medical field. Therefore, AI can be a useful tool and resource. However, it can never fully take the role of the pharmacist. Here is a short insight to where Dr. Zabrowski thinks technology will fit into the future of pharmacy.
So I think the two main typologies that I'm going to offer for that are the advances in technology, broadly speaking, and I'll speak more specifically to that, and then the world of what's becoming personalized medicine. I think those are the two overarching things that in your class and people following you are going to be dealing with in your practice. So for example, with personalized medicine, biologics, gene therapy, I think is going to be here sooner than most folks think, especially with the advancements in AI.
Could you explain a little bit on what that means?
Okay. So, for example, right now, I know that some of our alums that I talk to over at Siteman are very excited about personalized cancer therapies, for example. Cancer or oncology is very much into the better hospitals. Some of them are still using chemo for everything and whatnot, but Siteman is personalizing it, and what they do is they take a genetic profile from a patient, and then they analyze it to see where the genes are, where faulty genes might be, or predilections towards certain things, which will rule out a certain class of cancer drugs and other cancer drugs that have been shown to be more efficacious in that particular person's profile can be used, rather than the old way of simply blanketing, here's a tamoxifen, deal with it.
Right.
And so, in that sense, and I think there's going to be more and more of that, especially I think AI is going to be sort of a catalyst that's going to accelerate that whole thing. I think like gene therapy, once it really starts to take off, there's been some setbacks. But I think once, with AI now, especially, is you can do a genetic profile so much quicker and less expensive with less labor. I think you're going to see more and more of that personalized medicine that's going to occur. And I think the shift from chemical compounds to gene therapy is going to change the way pharmacy. There'll always be aspirin. There will always be some chemical compounds, but the use of biologics and being able for a genetic counselor or a physician to be able to say, well, we're going to pull this bad gene out, we're going to put this good gene in, is not just simply addressing symptoms anymore. You're actually curing somebody. And it sounds like science fiction right now, but right. I do think, and especially for folks who are in pharmacy school now, and the good news is you're going to have the scientific background to be able to understand what's behind that. And I think that's super important. I think your faculty in Stillcop are very much aware of that. Even in the undergrad level, we're teaching about those things because we can't predict exactly what's going to happen, but we want to be able. I think professors by nature are futurists, even if we're historians. I think we're futurists in the sense that we want a sense of where is this going to go.
And then to wrap it up, let's revisit our story one last time. As you pick up your prescription for your sick 8-year-old daughter, you can be assured that your pharmacist is not only dispensing the correct medication, but has reviewed your daughter's entire profile to make sure that she is receiving medications that are effective and safe. In addition, your pharmacist can answer all of your questions about these medications for free, since they are the most accessible healthcare professionals. We are asking you to help us so that we can help you. Pharmacists are highly educated healthcare professionals and are critical to ensuring patient safety. Talk to your state legislators about allowing pharmacists to have provider status so that they can practice at the top of their knowledge and license.
A big thank you, students, for hosting the Dose of Knowledge podcast as part of the Pharmacy Frontiers. And thank you to our listeners for joining us today. Please share this episode with your friends and seek out other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.